We've touched on some of the early policy and personnel changes of the new administration, but now that we're well into things, it's a good time to briefly explain what we know and what it means for health and healthcare. And this is neither meant to be exhaustive nor finished. I think much more will happen. We're going to periodically report and discuss this, but there's enough now that we can talk. So there's been an enormous shift in personnel in essentially all of the health agencies. Some of this has occurred due to voluntary early retirement, some because of firing of folks from their probationary periods, some of it through wholesale reductions in force, including closing of massive programs in some cases, and some of it has been partially or fully voluntary when senior officers just no longer want to be there anymore and they leave. And the net effect of this is that large programs have been closed, leadership in key regulatory roles has been lost, and the bench is either thin or non-existent, and the remaining staff are left trying to figure out who they even report to and how they do the work. There have been broad cuts in the National Center for Chronic Disease and Health Promotion within the CDC, and that came alongside cuts to programs to prevent HIV, injury prevention, and reproductive health. At the FDA, leaders of major divisions, including our former faculty member Peter Marks, who led the Biologics Center, were forced to resign. Entire groups and centers shut down or plan to shut down. And it's really important for people to understand we're not talking about the political appointees who routinely turn over when a new administration arrives. These folks are part of the permanent workforce and have worked for Bush, Obama, Trump, and Biden in the recent past. Now, no more. We now have a clearer picture of how funding research is changing, and in many cases, high priority areas are losing their funding or being dramatically deprioritized. So while we've talked about health disparities and the need to prevent and treat HIV, these are no longer priorities for this administration. In some instances, for seemingly calibrated political purposes, institutions such as Columbia, Princeton, and Penn are having grants canceled. And at the same time, researchers there and elsewhere are having to either change their focus or fight for internal funding for ongoing important work, including diabetes, COVID, rare diseases, all at risk. And this will separately impact the educational mission of these schools. $11 billion of appropriated funding to the states for public health preparedness and epidemic management have been withdrawn. This at a time when we're having the worst measles outbreak in over 30 years. 23 attorneys general of these states are fighting this, but the intent of the current administration is clear and legal maneuverings have mixed records of success. Beyond specific programs, institutions near and far are curtailing or shutting many graduate programs that were previously fully or partly funded by the federal government, and state governments are facing uncertainty of their own in terms of budget decision-making. This is all to say that first, second, and third order effects are still to be determined in full. And lastly, I'll just say the impact on global health, both from the effective shutdown of USAID and the delayed or canceled funding of PEPFAR, will lead to countless deaths globally and a huge loss of standing in the U.S. Of the U.S. in the world. Our medical diplomacy days are over, apparently, at least for now. So I could go on and on. Unfortunately, the more I looked into it, the more I could see specific programs, AHRQ, ASPE, lots of things that were considered embedded in government and very important are just disappearing right in front of our eyes. It's a challenging time.